Hi everybody, Ralph Havens here. And I'm going to be talking to you a little bit about how to work with me one-on-one. Before I do, I want to give you a little bit of information about us, me and Jen and our family, and what I've noticed since doing this work. About 10 years ago, I met Jen, and when I met her, she had a neurological condition. People didn't call it that, they called it Jen speak. And she basically transposed words, and everybody thought it was cute that she talked in a funny way, and that was going on. But she also had a long history, and she dealt with a lot of anxiety and depression throughout her life. And she had a severe stomach issue, a severe belly issue, lots of constipation, lots of pain, always pain in her belly. And so when she met me, she was the kind of person, if she knew what to do, she would do it. And of course, I was hesitant to tell her too much when we first started going out. You know, you don't want to just impose your will on somebody, but I shared with her what I saw, and she went for it. And she changed the things in her life that needed to be changed. And I'm talking about a lot of things. And she got therapy from me and my staff and from my teachers. And she no longer has anxiety, and she no longer has depression. And her belly never hurts, hardly ever. If she eats something with food poisoning, she'll get a bellyache, but she doesn't get belly aches anymore. And she doesn't have any issues with constipation, and she's thriving on all levels, and she's doing stuff that she never imagined life could be the way it is now. And when we were getting married, our aunt, talked to her. And when I first met our aunt, she came to see me when Jen just had barely known me. And Jen had told her, you got to go see Ralph. So we were in San Diego, and she was visiting, and she had inflammation in the lining of her heart. She had a fever that wasn't going away for months. She was on multiple drugs for all sorts of conditions, including rheumatoid arthritis, severe pain in her entire body, all sorts of joint pains, swellings, heart disease, and diabetes. And so I saw her for 20 hours the first week, and her fever came down. And then she went back home, and she's also the kind of person that if she knows what to do, she'll do it. She'll change her mind with certain belief systems of what she's believed in the past, and she can change things. And so she did. She took my recommendations and she ran with them. And the short story of this wonderful story is that she got her life back. She got off of all of her meds for rheumatoid arthritis. She doesn't even have a rheumatoid arthritis doctor anymore. And years ago, she told me that she no longer has any pain. So when we were getting married, she took Jen aside and she said, thank you for marrying Ralph. And it's because her life got basically saved. You know, she was at a point where all she wanted to do was travel around and be with the family. She had retired from being a nurse, and yet she was dealing with all these medical conditions. And so if you're the kind of person like that if you know what to do, will take action and do it. Actually do it. And do it completely and do it well. If you knew what to do to get well, if you're that kind of person, and if you're the kind of person that knows that you want a different life, you know, whether it's love or relationships or money or your impact or your business and your health, if you really have a dream that you want to fulfill, but you don't know why it's not shifting for you, why you're not getting it, if you're looking to find the root cause of what's going on and you want my help, I'm here for you. And so for the right person, this is the perfect fit. If you're the kind of person that if you know what to do, will do it, if you'll show up for sessions, if you'll do the work, you can have a different outcome, a different life in your health and your relationships, in your love, in your happiness, and in your money even. So if that's you, if you're thinking that that might be something that you would like to do, then go ahead and apply to work with me. And I say apply because I only want to work with you if I think I can help you. So by applying, I'll have you fill out a form of a few questions so that I can get a better idea of what you're going through and what you really want in life. And then we'll meet for an hour and we'll talk. And I'll get to tell you what I see is going on with you, what are the root causes of what's in the way of you getting what you want. And if it's something where we both feel, you know, it would be useful to work together, then you can do this. Now go ahead and click the button below if this interests you, and apply for a time with me. You'll be getting a link to my personal online scheduler, and you'll be able to book a time with me. It'll be an hour, a complimentary hour, free hour, and let's see if we can do something for you. So I look forward to hearing from you, and this is Ralph Havens, and I will talk to you all soon. All right, bye now.